Hi, everybody, and welcome. Thank you so much for joining us today and taking some time for this conversation about the Canopy Revive partnership and this next step in our journey. I'm Anna Miners. I know most of you. I'm so happy to see many familiar names and faces, not on the call that I can see you, but names. And just really appreciate you taking the time to be here today. A couple of quick introductions and some housekeeping items before we dive in. Please do feel free to use the chat. We have Randy and Shannon monitoring the chat in the back end, and we'll have about 5 to 10 minutes at the end for questions as well. We also have our tech team monitoring just to make sure everything's running smoothly, and are joined by Robin Handy. He's the Senior Vice President at Revive, who I will kick it over to here shortly. Some housekeeping items we will be sharing afterwards, the slides, so you'll get a copy of those. We also do encourage you to complete the survey link that comes your way after conclusion of the webinar. So as most of you know, earlier this year, Canopy joined the Revive Alliance of companies. And this is a group of like-minded organizations that are coming together for whole person health. And so this alliance is built around the mission of breaking down barriers and fostering healthier and happier futures while creating greater access to care. And like Canopy, Revive really is focused on making support both accessible and affordable for your employees and for you as an organization. And what makes this partnership really a strong fit, it's not really about just adding more services, it's about amplifying what already works at Canopy and expanding our ability to meet your needs in really meaningful ways. And just with every new chapter, we know can come questions and also opportunities. So that is our time together today. For you and your organization, this partnership really is bringing what I consider to be the best of both worlds. So you still have the consistency of the Canopy team and name that you know and trust. All of our services, member access points, contracts, materials, everything stays in place for that continuity that you rely on. We also will be able to offer continued innovation. Those of you that have worked with us for a long time, or even some of our newer partners, recognize that innovation is a key component of the way that Canopy provides services. And so by joining forces, we're adding additional expertise, resources, technology to continue to deliver that best-in-class support and cutting-edge digital tools. And then also expanded reach. So we already have members, we already serve members in all 50 states and beyond. Many of you know that, but this partnership with Revive broadens our geographic reach and expands our provider network and offers more diversity and availability. So with that, I am excited to introduce Robin Handy. Robin, thank you for joining us today to just share more about Revive services and what this expanded capability means for Canopy.
Absolutely. Thank you very much, Anna, for the introduction. And welcome, everybody. Thank you for taking time from your schedule this afternoon to join us. I look forward to your questions, so please feel free to put them in the chat. We have people that are monitoring them for you, and I will look forward to sharing some information with you. And hopefully we'll have some dialogue back and forth to be able to answer some questions for you as I go through each of our slides in the presentation. Anna, are you able to reshare?
Give me just 1 second here. Got a click situation happening, but
I can probably do it off the top of my head if I need to, but the slides are a nice guide.
On track. Oh, let's see here.
Thank you.
Okay.
Awesome. Thank you. So as Anna had shared, I'm the Senior VP of Customer Success here at Revive. I've actually been with Revive since inception. So I've had an opportunity over the years to serve in a lot of different functions within the organization, to see us grow, to understand why and what we are as an organization, why we came together. This was a group of like-minded individuals who really was looking at how care was being delivered today and really wanted to see if there was an opportunity for an organization like Revive to reimagine how care is delivered and how we can work with employer groups, sponsor organizations to really enhance the benefits that employees have and access to care. Next slide, please. So what we looked at as a mission is to really work with employers and plan sponsors to help you optimize the benefits that you already have. Now, that's not me saying we don't think that you're smart individuals and you can't do this on your own. Absolutely, we understand that you're doing everything in your power to optimize benefits and provide them and get them in front of your employees. What we're trying to do is just to help you with some additional solutions that are out there to really increase or improve access for individuals, help lower the overall cost of care, and then also foster a healthier workforce. So you want your employees to be healthy, you want them showing up for work, you want to increase productivity, and you also, I think when you provide benefits, you want your employees to be able to use them. So having that point that is really easy for them to access is very, very important for all of them. We proudly serve over 2,000 valued customers that we have on the platform right now. And these are groups that are anywhere from 5 employees to 5 and 10,000 employees. So we actually have over 4 million members that are on the platform. And in a year's time, we actually provide over 5 million member encounters with our providers and clinicians that provide care and access to care for individuals. So a tremendous platform that's been built that is really designed to serve individuals and serve them expeditiously. So we're here as an organization and working with the partnership that we have with Canopy to really solve for those access and affordability issues while helping organizations and plan sponsors understand how benefits like this can actually decrease the overall cost of care. And so we have tremendous programs that we can roll out and examples that we can share with groups to help them understand that if you utilize a particular service that's in our ecosystem, what that would actually look like in terms of potential plan savings across the board. So next slide, please. So when we talk about these services, as you can see, there's nothing in here on this slide that says EAP or EAP type services. So those services are going to stay in place for you. So we have an ecosystem that we've built here, and the core ecosystem that many of our employer and sponsor groups like to utilize is what we look at as urgent care or access to virtual urgent care, access to virtual primary care, mental health services, but you already have that component through your EAP services. So we're not asking you to change that, right? So we would take that out of the mix. And then you have the pharmacy benefit. And then we also recently launched a great program called Wade Health. And so we have access there to medications, along with access to providers and coaches for individuals to really give them that engagement that they need while they're branching out on their weight health journey. So what I'd like to do is just kind of talk a little bit about what this looks like. So why employers love Revive. One of the things that we're really able to do that's so much different, and this is probably what you're asking yourself. You might say, well, Robin, we have Teladoc on the fine print in our system. If an individual wants to use Teladoc, they can call Teladoc. And that's perfectly fine. And some may be doing that. But what we tend to see with services like that that are already embedded in your plan is that they get very low utilization. And it's kind of by design, unfortunately, anywhere from 2 to 8% in terms of utilization. What we strive for here at Revive is anywhere from 40 to 50% utilization, because then we truly feel like you're getting the return on your investment and generating savings for your overall health plan while improving the overall health of your workforce. So we utilize strategic enrollment campaigns, emails, text messaging. We work with you, the plan sponsor, to help roll this out to your employees, whether that's through webinars, educational on-sites in some cases. So we're very proactive, but not in your face proactive. I don't want you to take away from this meeting and discussion here that we're like on top of your employees every second of the day. That's not it at all. We're just truly there to help engage them. And they certainly have the opportunity, as with other types of programs, if they want to disengage at any point in time or take themselves off the mailing list, they certainly have the ability to do that from a welcome email standpoint. So but the nice thing is we're very proactive about that. We can also drive hard dollar savings for groups. And this is something that we call redirection of care savings. So if you think about it, if we take an individual that maybe would have gone in person to an urgent care or an emergency facility or a specialist or maybe even their primary care doctor and had an appointment, that appointment has X dollars of cost to it, not only to the member from the standpoint of out of pocket or deductibles, but also to the plan sponsor as well. There are costs to that. The cost here from this type of program is so much less. And so we redirect those costs out of your traditional health plan and into a much lower cost scenario. And so we're able to then take those numbers and kind of provide back to you what we call a redirection of care savings. And for many individuals, or organizations, it's a 2 or 3 to 1 savings with regards to what you get in return versus what you're spending for the program to have for your group. So a very simple model. It's just per employee per month, and you can enroll employees only, you can enroll employees plus spouse, you can enroll families. And so that decision and that choice is up to the employer. And it's also up to the employer or plan sponsor whether or not they would like to roll this out to their entire workforce, their full-time employees, their 1099s, part-time employees, seasonal employees. So it's really nice from that standpoint. The other thing that I want to share with you, as we looked at that ecosystem before, you might look at that and say, well, Robin, I don't really have an interest in all of those items there, but we're currently talking internally about, access to urgent care, and can we cut our costs in our urgent care visits, et cetera, because there are a lot of them. And absolutely you can. So you could look at us and say, out of your ecosystem that you have there, Robin, we love our EAP services, but could we add virtual urgent care that our employees could access urgent care through the virtual system? Absolutely you can. And we're certainly open to those discussions. So I wanted to step back for a moment because I didn't want to leave you with the impression that you felt like, well, you have to buy all of these services. No, absolutely not. One of the other things that I also like to share with individuals is that we do send out surveys to individuals after they have engaged with us and received care. And I'm really surprised at the number of people that respond. I think it's because they really truly appreciate the service and the benefit that they have. And I can also share with you that our scores are extremely high from a satisfaction standpoint. And the feedback, a lot of people actually provide comments to us. The feedback we get is absolutely tremendous, that having had a benefit like this saves them so much time out of their schedule. If they're running a busy schedule, they have family that they're trying to take care of, and they need care for themselves or they need care for a loved one. And it's just so easy for them to be able to do this. And to have a platform that is all together, that allows them to receive that care in one unified place, is a tremendous benefit. So this technically works outside of the health plan. And so the nice thing about that part of it is that we know this happens sometimes year to year or every couple of years. You may look at your current traditional benefits and say, I'm going to switch from Aetna to Blue Cross this year. We're going to go to Cigna next year. The beauty of the benefit here is that you can keep this benefit regardless of what you keep for traditional health plan. So we work outside the health plan, but what's nice about what we also do is we work with the health plan. And what I mean by that is this: all the care that is received or medications that are provided and prescribed here are not done in a silo. So the system was built so that we share information and data through the Health Exchange Information Network, which is a secure network that allows us to provide that medical information back up to the Health Exchange Network, basically. And for example, if you happen to stop in to see your primary care doctor for an annual physical, that doctor would be able to look in the system and see that, oh, I'd see that you had strep throat 3 or 4 months ago and that you received a prescription for amoxicillin. Vice versa, our providers, when they're providing care to you, can also see that, you were in for your recent physical, right? And so it's nice because there's continuity of care and we're sharing information with the health system so that your traditional health benefit can actually see that there is care being provided there. We don't charge them anything along those lines. This is strictly a per employee per month basis that's paid for by the plan sponsor. And so that, as I talked about earlier, with regards to tailored bundles, so you can take those bundles and make them anything that you want. You might look at us and say, we'd like our EAP program. We'd like to talk a little bit more about weight health and urgent care, and we can have a discussion about putting those particular services together for you. It allows you as well, with regards to a benefit like this, to kind of have predictable costs so you know what your PEPM is every single month. So if we look at what these core virtual services look like, oh, there we go. Urgent care. One of the most used benefits that we have out there today is actually 24/7, 365 availability for your staff and their immediate family to be able to access. It's nationwide, all 50 states. And it's provided by a pool of doctors that are captive to us as an organization. And what I mean by that is it's different than from other telemedicine groups in the sense that go out nationwide and they contract with all kinds of doctors across the nation. Here we have a group of captive individuals that only provide telehealth for Revive. And in some cases, that's all they do. This is their practice. They've been practicing for over 10 years in telemedicine. They're all US trained, board certified, and based in the US. And so beautiful from that standpoint because they understand the expectations of our customers and the quality of care that we want to deliver. So it's nice because with a system like this, we can control the response times. So often what we see is within 1 hour's time, we actually get back to 98% of individuals to provide them with care, which is tremendous. And if I look at it from a 20-minute window standpoint, that first 20 minutes after a call, for scheduling an appointment with us, we get back to individuals 94, 95% of the time within 20 minutes. So that's even during peak season. So like January, February, March, when we're pumping through 20, 30,000, members in a month for appointments, we're still able to maintain that level of efficiency with regards to providing care. And what's so nice is, as this shares with you, there's no out-of-pocket expense for the member. So again, it's a PEPM basis and the member doesn't have to pay any deductibles, no copays, nothing. And there's no additional charge to the employer above and beyond, or the plan sponsor above and beyond the PEPM. Next slide. Our primary care works very much the same way, but this is a little different. We have, again, a group of captive providers that do primary care for us. And so they can treat more common conditions that, maybe you want to manage your arthritis, or maybe you want to manage your cholesterol with your primary care doctor, because it's so challenging sometimes to get in to see your in-person doctor. Wait times can be 4, 6, 8 weeks, depending upon where you're at in the country. With the system here, you're able to see a primary care doctor within 1 to 3 days. And if you want to schedule with your doctor over and over again, that's the beauty of this system, is because we have those captive doctors, you can actually go in and pick Dr. Lemarand and say, I like Dr. Lemarand's profile. I met with Dr. Lemarand once, great personality, gets me. I'm going to stick with Dr. Lemarand and see him again for my next appointment. Now, in this other breath, if you, for example, we don't always hit it off with everybody, right? If Dr. Lemarand doesn't float your boat, so to speak, and you want to see another provider, there's nothing in the system that says you can't look at another provider's schedule, and you can schedule accordingly. So nice from that standpoint to be able to have access to a primary care provider if you don't have urgent needs, but you do want to have some medical concerns addressed by a primary care physician. Those individuals can also prescribe for you, as well as can our urgent care providers. Next slide. This is a really nice benefit, and a lot of people also, this is probably the second most used benefit that we have, and it's the pharmacy component. So we actually own two pharmacy benefit administrators, and there's one on the East Coast, one on the West Coast. They're both dispensing pharmacies. One is fully automated, the other one's partially automated. We have the capacity to ship up to 60,000 scripts every single month. What we've done here with this particular service is we have carved out a set of what we call free medications. There's maintenance medications, and then there are urgent medications. So let's talk about the maintenance medications first. We have over 1,000 formulations of the most commonly prescribed tier 1 generics today for treating cholesterol and diabetes and other conditions that individuals might be taking maintenance medications for. These are covered at no cost. Over 95 to 98% of them are 90-day scripts. There's a few that are not. There are 30 or 60, and it's just because of limited quantities. But the beauty is that there's no cost for these to the member when they go in for their cholesterol medication or their hypertensive medication, and they transfer it to our mail order pharmacy. We will ship it to them in 90-day supply, and no cost, no copays, no shipping fees. The other side of the benefit that you have is the urgent care medications. So we know that individuals, when they're seeing a primary care doctor or even an urgent doctor or urgent care doctor, may be prescribed something for their ear infection, their strep throat, their pink eye. We cover up to 70 of the most commonly prescribed acute medications in the US today that can be picked up at any of 70,000 plus participating pharmacies across the US. And there's absolutely no charge to those medications for the members. So really two nice components. And there's a third component here as well that is a discount card. So a lot of us have heard of GoodRx, and maybe some of us have even used GoodRx. So this discount card operates very similar to the GoodRx card. What we find when we do our analysis and checks on a monthly basis is, in actuality, it beats GoodRx anywhere from 70 to 80% of the time in terms of providing discounts. So if a member does have a medication that's maybe not covered by this benefit, or maybe it's not even covered by their traditional benefit, they can always look at that discount card and see if the discount card provides them additional savings. Our pharmacists are also available for consultation. So if somebody needs to talk to one of our pharmacists, they're there and at the ready to help an individual out anytime they need assistance with their medication. Weight Health is a newer program for us this year that we launched, and we really love this concept of helping employers and plan sponsors really manage the cost. We understand how costly the GLP-1s have gotten, and that many groups are looking to try and carve out those GLP-1s and only limit them to use, for treating diabetes maybe. And so individuals who do want to use them for weight health, unfortunately, are left maybe picking up the burden of the cost for those medications and maybe not having the support that they need. So what we built was a physician-led, basically, program that helps ensure that individuals stay on their goals and that we get them on the proper path. So there's two types of individuals that come into our system for weight health. There's an individual who might qualify for medications based upon their condition and their body mass and what their goals are. And then there are individuals who maybe they're not at that point yet, but they can still benefit from intervention. So maybe they don't qualify for medications. So if they don't qualify for medications, we have the ability to connect them with a provider, obviously, to talk about their goals and their health status, to connect them with a coach, a weight health coach. And then we can also tie them into FitOn so that they can take advantage of the FitOn app and the programs that are there and work with their coach through that program for exercise, diet, and those kinds of things to help them achieve their goals. On the other side, the individual who might qualify for medication intervention has access to those same steps that I just talked about, But the advantage is now here they have access to medications as well. And we start out with kind of a step process for individuals. We start out with oral Contrave, we go to an oral semaglutide, and then we go to the injectables. We don't always rush to the injectables right away because we do see individuals responding very well to oral medications. And in many cases, those oral medications are less costly than the injectables. But the other nice thing is that plan sponsors do see savings if they want to sponsor the benefit or the cost of the medications, or even the members. If the plan sponsor says, no, our members can pick up the cost of the medication, the cost of those medications is far less than what they might be paying at a retail pharmacy. So this is a really cool benefit, and we continue to look at ways to enhance this to really provide a nice member experience and continue to engage them on their weight health journey, because that's the other thing that's so important. Weight health is about so much more than just losing the pounds. It's about changing and transforming yourself as an individual and leading a healthier lifestyle, both mentally and physically. So this program helps to address a lot of those things, you know? So member experience, what does this thing look like? So we have a beautiful app that's out there. It's also web optimized, so it can be viewed on a web or your laptop or on your phone. It's all in one access, and you see a lot of the different services that I was talking about here. What's nice about this is members, when they come into this, will only see the services that have been contracted for. So again, I shared with you before that you could select different services, and we do actually have plan sponsors that do this. So for example, you might look at us and say, hey, we would really like to offer this full package to our full-time employees. We don't do much for our part-time employees, but we really like to give them some type of an incentive, keep them healthy. And so we'd like to offer some type of health benefit. Can we just offer them maybe access to urgent care and medications? Absolutely, you can. And when a part-time individual comes in, they would only see the urgent care tile and the medication tile. But when one of your full-time employees steps into the program, they'll see all of the services that you have contracted for them to be able to access. And it's so easy to make an appointment. You click on the urgent care card, you're given a very simple, quick intake form. We don't ask a lot of questions because we know when you're sick, you don't want to spend a lot of time answering questions. So our doctors are very good at what they do. And so there's a little place for you to put some notes. They're pretty good about reading all of that stuff and coming to the table when they meet with you, either by phone, or we can also do video if an individual would like to do video. They're very good about helping you out and getting you on your way. So it's very easy to schedule through this particular portal. So program promotion. So we talked a little bit about it before when I shared with you information around engagement. So we do emails around helping individuals register, reminding people to utilize the program, right? It's fall season. You haven't had to use this thing all year, and now it's cold and flu. Kids are back to school. They're bringing home things that everybody else is getting at school, and the household is sick before you know it. So we try and remind individuals that the service is there. So nice from that standpoint. If we have SMS, or if we get texts, or sorry, talking too much and too fast, I think. If we actually get phone numbers that are cell phones, we can do SMS campaigns. And so again, it's just reminders for individuals. We also do send out a welcome SMS text message to individuals to allow them to even enroll from their phone, because we do know that some employees and individuals within their family just respond and work so much better in text messaging and don't do a lot with email. And of course, we have the digital materials that are out there. We've got benefit guides that we can provide. We've got flyers and posters that help with engagement and enrollment, monitor graphics. We've got FAQs out there and webinars that we can do for your employees, et cetera. So we are here to help you launch a successful program. And so members love us. I mentioned to you all earlier that, we get a lot of good feedback on this program. And so, it's really interesting. We got one very large employer in North Carolina, and the employee was looking at actually resigning. And we rolled this benefit out, and we actually got this feedback, and I just love that they just really appreciated the benefit and having access to it, and it made a difference for them. So many people comment about how easy and efficient it is for them and the importance of saving money. I'll never forget 4 or 5 years ago, I launched this to an employer in North Carolina of about 67 employees. And I followed up with the employer and the director of HR maybe 4 or 5 months later. And there was a gentleman on the line. This was a factory scenario. And so he was on the line making $20, $25 an hour roughly. The HR director shared with me that because of the pharmacy benefit, he was able to transfer a significant number of his medications to the program that were covered, but he was still paying out of pocket through his health plan. He was saving $765 a year. And for him, that was such a significant win that his employer rolled this benefit out, made it available for him, and it also allowed him to save money. So we have reporting. And so this is a kind of a mock-up of our reports that we actually provide. We show engagement, we show utilization, we show number of physician visits over, from a monthly. So it's all de-identified data. So we're not going to share with you that, Sally had a mental health appointment yesterday or an urgent care appointment this afternoon at 2 o'clock, but you can at least see that there's engagement. And we also provide you with kind of this year-to-date savings so that you can see how the program is performing in terms of each visit that is had and what that saves. We also do a very similar compilation with regards to the pharmacy services. We know that when medications are redirected to us with regards to maintenance and or urgent care medications, that we can save a plan X number of dollars. And we provide those computations here in a very simple, straightforward report like this that you're able to access in what we call a plan sponsor portal. So remember, we talked about the member portal before, but for plan sponsors, we also have a portal for you to be able to access to see information like this. So we talked about the cost savings. This actually gives you a little bit about what we're looking at. For every visit, on average, again, this is on average, every visit that we redirect from one of those 4 in-person scenarios that I outlined previously, specialty, primary care, emergency, urgent, to a virtual visit, on average, we save $367 per visit. So if you do the math for many of those and you get a group size of 1,000 and you get 50% engagement, basically what you're looking at is $183,000 in savings per year. When you look at the cost of this program, in many cases, as I shared to you, it's a 2-to-1, 3-to-1 ratio sometimes. So you can tell by that the program doesn't cost nearly as much as what you're looking at from a savings standpoint. And as I just shared just a moment ago, you can also see that we have kind of an average median savings that we utilize to help individuals calculate what their savings is when they use the pharmacy benefit. And we use a figure of about $25 on average. And so we can save tremendous amount of money on the pharmacy. What we do find is this: when groups want to come to us, they can provide us a list of their medications that are used over the last 6 or 12 months. We can actually do an analysis and a cross-reference for you to tell you how many of those medications actually match up. In many cases, what we find, it's about 60 to 70% of the medications match. And of course, as you already know, because you've looked at your benefits, you looked at the cost, the most costly medications in there are those, the biologics that are out there, et cetera, that really truly drive the cost on your plan. But a program like this can truly help on those other medications and saving dollars on that plan. So, Revive, your organization's health benefits. I really do appreciate all your time. I know I went through a lot of things very quickly, and I see there's a lot of information being exchanged in the chat. I don't know if questions have been answered as we've gone along by Randy and Shannon and the crew, but I'm certainly open to questions and happy to answer as best I can for individuals.
Hey, Robin,
Thank
there are
you,
a couple of
Robin.
questions.
Yeah, go ahead, Shannon.
Oh,
Yeah,
sorry.
go ahead.
There are
That's
a
right.
couple of questions that
Yeah.
I didn't know the answer to yet, and so
Okay.
thought we would ask them here. So one question, there's a few questions around the pharmacy benefit.
Yeah. Yeah.
One question is, where would insulin fall in the formulary?
Very good question. So we actually do have available at retail pharmacy for pickup Humalog for $5 a vial. So unfortunately, that one's not free, but much less costly than what an individual would pay out of pocket if they were coming to a pharmacy to pick that up at retail. So as you know, most of these other medications for treating diabetes and the insulin front are far more expensive. So this is the one that we've been able to include in our pharmacy benefit, but at a much reduced cost for individuals.
Great.
Yep.
And then we had the question of how well does Revive, the pharmacy benefit, play with Kaiser?
I've gotten this one before. Actually, we play quite well. So you're redirecting these medications, lower cost medications. And to be honest with you, that's not where Kaiser's making their money. Okay. So the tier one generics, their bread and butter are those biologics, those high cost medications. And so when they see a plan like this and we're redirecting those lower cost tier one generic medications out of their plan, we've had no problems with individuals who roll it out.
Great, thank you. And then a question about eligibility came up. You know, how would full-time versus part-time be identified
Yeah.
within the
So
system?
yeah, so what we would do is on an eligibility file of some type, we would just call out in there a designation that this individual is part-time or this individual is full-time, and we can include them on the same file. So they don't have to be separate files. And then when we load them in the system, we would designate again, if you chose different benefits for them, we would set that up so that those who were designated as part-time would receive X benefits, those who were designated as full-time would receive Y benefits. So very easy for us to do technologically on the back end.
Great, thank you.
Yeah.
And then this was a good question. With the Weight Health program, can FSA and HSA be used to purchase the medications?
Yes, it can, absolutely. And so our pharmacy is very good about working with individuals and, making sure that we get their medications out the door very quickly, and then obviously getting them paid for as well, whether they pay by credit card or utilize their account or turn it in for reimbursement. So they may pay by credit card and then we give them the receipt and then they can turn that into their FSA, HSA if they want to. Yep.
Great. And I think that there's a question. Oh, and then there's a question around cost. And I know that,
Ah,
yeah, I know
the
that's,
$1 million question,
yeah,
huh?
exactly.
Is there a cost to this?
It's all free.
So I can give you what I hope you will understand is a very extremely beneficial value. So if we talk about those core products that I shared with you before, urgent care, primary care, mental health will take out because you have EAP. So urgent care, primary care, and the pharmacy benefit for a family of up to 7 individuals, you'd be looking at $20 a month. Okay. So the nice thing is that our program also can be divvied up this way. If the plan sponsor, program sponsor wants to look at it from a tiered level, we have single rates, single plus one, and family rates. We do have a lot of plan sponsors like, you know what, I don't want to go through that and look at my invoice and have singles and plus ones and how many this month and last month. Oftentimes we do a composite rate. So a composite rate on those services for a group would be probably $16 if I remember correctly.
Yeah, I
Yeah.
think that was the number that Randy had put in
Yeah.
earlier in the chat.
Did you, Randy? Okay.
Yes,
Yeah.
I did.
Yep.
Mhm.
Thank you for that. Yep.
And just to chime in there, I love all the questions coming in the chat, but of course we can follow up and have pricing conversations
Oh,
with
absolutely.
folks based on what are your needs in your employee
Preferences.
population, what other benefits do you have in place, what,
Yeah.
all the different moving parts that come into that conversation. So Robin, thank you, and Randy in the chat
Yeah.
for kind of giving those numbers and some ballparking and things, but we also
Yeah.
are happy to follow up on those conversations with folks as
Absolutely.
well.
Yes.
Yeah.
Yeah.
Gosh, now the questions are really coming in the
I
chat.
know they are.
I love
Fast and
seeing.
furious. What question is what is the adoption rate like when implementing this in the first year? It
We
says it seems like it could be confusing for employees to know when to go to Revive and when to go to their, regular medical program.
Yeah, so we do a very good job of working with you and educating the employees and their significant others who are on the program of when and how to use this. So think about it this way when we talk about rolling this out to individuals. This is almost what we would call first dollar coverage, right? So most everybody has a deductible. So and a lot of people don't like to pay out of pocket, but they don't like the inconvenience of having to go sit in person. So what we're really trying to do is to educate them and say, look, if you want something that's simple, that's easy, that doesn't cost you anything out of pocket, that you can get taken care of in a very short period of time, instead of going and taking 3 hours out of your day and worrying about getting childcare for the kids after work and all of those other things. This is a very simple benefit to be able to utilize, and we refer to it as kind of that first dollar coverage. Think about utilizing this first. And then the beauty behind the program and utilizing something like this first is our doctors are great from the standpoint of, look, you come to us, they're going to share with you whether or not they think that you should be seen in person. Okay, we're not going to drag you out or string you along or anything like that. We're going to, if this is something you should truly be seen in person, we're going to make that recommendation. What I also like about how the ecosystem works that we built is this: those notes go into your profile, and we have a group of care advocates that work on the back end, and as they review those notes, if they see that the doctor has recommended that you should go in for an x-ray for that ankle, they will pick up the phone and reach out to the individual and say, we see that Dr. Lemoran has actually suggested you get an x-ray. Would you like us to assist you in working with your health plan to get an x-ray in your local area? No, I'm good. I can take care of it on my own. Or yes, could you really? I actually have Cigna and it's this plan and here's the number. We'll actually reach out and help the individual get an appointment scheduled for an x-ray if they need to. Okay. So we really do work with individuals to help them have a seamless care experience.
Thank
Something,
you.
Robin, that has stood out to me that I know we get asked a lot about how to help people around like social determinants of health. How are we helping
Yes.
people with
Yeah.
access to care and,
Yeah.
living paycheck to paycheck, and how are we supporting populations? And when I hear you give examples of folks that are saving money by using the pharmacy program or using this as an access point where there isn't a barrier of a copay or deductible. I just talked to someone last week. They're using someone in network with medical, but the copay is too much for them in their monthly budget. So I think those are important parts. And then the other piece that you have talked about, which I think really aligns well with Canopy, is our flexibility in the benefit. So if
Yeah.
you want to offer it to your part-time folks as a way to, enrich the benefit, or if you want to, be more broad in your eligibility
Yeah.
definitions. So I think those are a couple of call outs that align with what we
Yeah.
hear a lot at Canopy.
And all of you who are on the call, I'm sure you've seen the statistics, and sometimes it's shocking to see these when somebody puts it in front of you, because we don't see it on a regular basis. But to think that a family with an income of 200,000 and of four could truly be struggling with social determinants of health is absolutely very interesting and unique. We think that that's a lot of money, but in today's world, it's not. And the nice thing about our providers, with all other providers, they're trained to listen for those keywords, and when they hear them, they jot them down in the notes. And so that's the other part of the benefit that Anna's getting at, is when those care advocates go through those, they look for those keywords. I'm having problems with childcare. That's why, I'm depressed because I can't find childcare or something like that. And so we look for those and we reach out to the individuals. So the nice thing is that our care advocates are also in tune to that, and the local networks. So they will help an individual, if they need to, source resources in their local area for SDOH. If the individual wants to take their own path, we'll provide them with the resources and allow them to walk on that path on their own. But we're also there to help them if they need it.
Great.
I know and I love that there are so
Yeah.
many questions. I'm also being thoughtful about people's time because this was scheduled as a 45-minute webinar. So if we haven't answered your question yet, we absolutely will follow up with folks that are entering into the chat and make sure that you have the support that you need to get your questions answered. Robin, I did want to thank you again for your time. Randy, I know you're on there on the backside somewhere, and Shannon, thank you. So just to remind folks, you will receive a survey link. Thank you so much for completing that when that comes to you. Your feedback is really helpful for us in designing our webinar structures. We are recording. You'll receive an access link to the recording, and you'll also receive a copy of the slides. And we will follow up with you with your questions, but don't hesitate to reach out to your CSM here at Canopy if we can have more conversation with you. We're happy to continue to do so. And Robin, again, thanks for joining us
You're
today.
welcome. And thank you, everybody. It was so nice to have all of you present. And Anna knows this as well. So you may not have seen the last of me. If you'd like me to join you again, I'm happy to. If there are individuals in your organization that you'd like to have a discussion and have me present, Anna knows that I'm always happy to join a call and help out and answer questions.
Yeah, that's the accessibility and the partnership that we're talking about, right?
Absolutely.
Thanks, Robin.
You
Appreciate
bet.
it. And
No
thank you,
worries.
everybody, so much for joining us today. Take care.
Yeah. Have a great day.